According to Accenture, by 2021, 1 in every 13 patients will experience some form of medical theft due to data breaches. Today, we're meeting with Chrissa McFarlane, founder and CEO of Patientory, a blockchain technology that is committed to empowering patients to securely manage their medical information. This is Founded. So before we jump into learning more about Patientory, Chrissa, I'd love to just learn more about you, kind of what your story is, how you kind of are able now to be where you are today.
I actually was born in Jamaica and migrated to New York City at the age of 3. Grew up in New York City, attended specialized science high school, went off to Cornell, Ivy Leagues, was pre-med. So a part of me always, wanted to be in business. And just being exposed at an early age to sciences and research, I also wanted to practice as a physician. So I had this idea, while in undergrad, how can I bridge the two worlds together?
Why did you decide that you wanted to go to med school?
Growing up, it was just always this part of me that loved helping people. Being involved in the community. So I lived in the Bronx, found that a lot of, especially the women, were diagnosed with diabetes, which, definitely affected me and how I saw I can help serve and be of help to my community. One of our core missions is, we're empowering patients, but everyone is a patient. It's more of the sense of consumers. We're empowering consumers to really take action in owning or being the custodians of their health data. And our companies focus on providing those analytics to more actionable insights on how they can improve their lifestyles on a daily basis.
So now bring us to Patientory. What kind of pushed you to want to actually take it to the next level?
So I was with a telemedicine company. And one of the biggest challenges we faced was just getting access to that information. And we thought EMRs would actually help solve this portability and accessibility to the information, but they actually created siloed walled gardens, and that data is owned by the hospital, not the patients. So it made sense. The light bulb came on and it's okay, how can we, better address, at least foundationally, the infrastructure of our current health information system. So I started to do more research, as my background prepared me for. And really started to think about, okay, how can I really frame this into a business? So with that, started to look at the technologies that were also emerging in the space, doing more research on that, and then came across blockchain, looking at how it works on a peer-to-peer mechanism and really seeing the disconnect between current healthcare silos. So it just made sense. It seemed as if that was the next step to really bring this all together.
Right. One of the huge issues around electronic medical records is that there's a privacy issue. Can you talk a little bit about kind of how your technology is helping to actually avoid some of these privacy challenges that are coming up?
Absolutely. HIPAA, for one, is a burden for most developers in the space as it relates to electronic medical records. But with the use of blockchain, which is, a secure distributed ledger technology, as an entity where we aren't storing that data, the custodian of the information resides with the individual. We secure it through the replication and the sharding of that information across the network that is housed by the hospitals. And then we provide the front-end solutions for consumers, a mobile app where they can go in and request that information from their physicians.
Take us 10 years down the line. How is the world different for maybe even folks from your neighborhood that you grew up in because of the work that you're doing?
I think, we'll be successful in that we're able to provide that information and that the data and the key points to actually start to drive change.
For anyone watching this who also feels passionate about healthcare transparency, for information transparency within the industry, what is something that you would kind of advise them to do to be involved, to help move the needle forward on this issue?
Yeah, I would say, join your local healthcare community organization. We also have a nonprofit, the Patient Tory Association, and a team of ambassadors, over a dozen ambassadors in 10 different countries around the world. So you're really more advocacy. So getting involved in an organization to help advocate for this as it continues to drive the industry forward. But if not, really being a user on our application.
Thank you so much, Chrissa, for sharing your story, for telling us about your vision for Patient Tory, and for the work that you're doing every day to make the healthcare industry more transparent, to allow people access to their own medical records.
Thank you. I really appreciated sharing my story with you. And again, thank you for having me.
Of course.